breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, and welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host and co-conspirator, Dr. Glenn Harrison. What's up, buddy?
I'm doing well. How are you doing on this fine evening, Dr. Kolby?
It's good, man. The weather here in Minnesota can't decide what it wants to do. It's going from like 80 degrees one day to 50. I think next week we're supposed to get a dash of snow, which is kind of unheard of this time of the year, but
well, that's good. That's good. You always got to keep your boots close to the door, right?
Yeah, we need some moisture, so we'll count it as a win, right?
Well, that'll work out well with the cementing, won't it?
Yeah, no kidding. I'm getting ready to pour this pad at my house, and I've just got a million things going on. I'm like, great,
let's have snow or rain. I'm going to shovel it off first.
It's making me old.
It's making you old. I get that. I see that. Or do you feel like you're aging faster as time goes on here?
I would say yes. With the amount of stress in my life right now, I'd say definitely. Which segues perfectly into what we're talking about, which is what does healthy aging look like? If this is your first time listening or watching and you feel like you got value from this content, make sure you hit like and subscribe, turn on notifications, because we are going to continue to roll out new content each and every week, and you never know when we might do something that is beneficial to you. So without further ado, and without wasting any more time, let's get after it. What does normal, healthy aging look like?
I think that's such a big question, but hopefully we can debunk a little bit of that today. You know, I know with the same thing with you in practice, we see all of these individuals coming in and you know, they're younger, they're older, you know, it's everything's relative, I think, relative when it comes to age. But what are we always trying to do with chronic illness? Everybody was healthy at one time. And if it goes on long enough, we're trying to reverse it, or we're trying to get out of it. We're trying to turn it back. It's almost like we're trying to turn back the hands of Father Time. And I think that's where things get a little bit blurred, where, where is there a premature aging or is it a healthy, aging? And we have to accept one, but we shouldn't accept the other.
Yeah, I would agree with that. When you start looking at it, like you talked about, when does it start? Is it in your 30s? Is it your 40s? Is it even later, your 60s? And I think honestly, when we look at it, at least from our perspective, aging starts to happen when you can no longer keep up with the physiologic demands of your day-to-day life, right? So all of a sudden, the amount of oxidative stress that you're going through in the amount of day, whether that's stress from work or whatever, you have all of these that you're no longer able to buffer that, and you can no longer keep up with the demands. So you will actually have alterations in your DNA. Your cells will actually change, and that's kind of how I view aging. And all of these different aging facets move on into your systems, whether that's your cardiovascular system, and then you have elevated blood pressure, or, you have, arteriosclerosis, or even changes in your neurology. Like all these things can really be the early onset of aging is what I would call it. It's
true. And it's never just one system, right? It's all these other systems that start becoming more and more difficult. And I know we had a few analogies about this when we were talking about this of what's the difference of aging when we're young versus old, or what we need to do. And I like the analogy of it's like a balancing beam, where when you're in your teens or 20s, or sometimes even early 30s, you can do pretty well anything, and you can weave around this beam and you won't fall off. You can live almost any kind of lifestyle, and you're not going to feel the repercussions for it. As we turn into our 40s, this beam gets a little bit more narrow, and 50s, 60s, 70s, we can still walk on the beam of health, if we will, but it takes less. We can't weave too much or we fall off, and we start to feel the symptoms, whether that's sleep, diet, food, emotions, activity, etc. And I think that's really what we have to think of when we're thinking about premature aging, or how can we age gracefully? I think that's really maybe the biggest thing.
Yeah, I agree with you. I kind of use the analogy when I'm talking to my patients that life is like a 8-lane highway. It starts out where you got nice wide lanes with a lot of pavement. And as we age, it gets narrower. It's a little bit harder to keep it between the mustard and the mayonnaise, as I like to call it, between the yellow and the white lines, right? And I think that the longer you're able to keep that road nice and wide, and the longer you're able to maintain your lane, honestly, the better off you're going to get, or the better off you're going to be as you get into your later ages.
That's right, because if you get sicker, you can't you can't do as much without falling off this beam, my analogy. And so you can prematurely, this beam can get smaller, 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 smaller. And you got to walk a finer line. But the interesting thing about aging is I'll see people that have turned 40. I've seen people that turn 30, and they're like, wow, they have some symptoms, and they come in and they believe it's because they turned 30. Now they're older. And then when they turn 40, and then so we want to blame these symptoms on age. And I think it just happens too frequently, where people are told, well, it's an age-related change. Let's just accept it. So hopefully we can debunk a little bit what an age-related change is, what versus what isn't. So maybe, I know we talked about abnormal premature aging symptoms. Do you want to start getting into some of that?
Yeah, I think that, well, and to kind of piggyback off what you just said a little bit before I move on to the next point, like, I always say when people's like, oh, it's normal age, I was like, well, then, you're 60. Why is it that you see some 60-year-olds that are running triathlons, or, they're able to do everything they absolutely want to in their life, and then there's some 60-year-olds that are bedridden and have, every symptom under the earth. So it really is kind of like one of my pet peeves, where people are like, oh, it's just an age-related thing. Well, no, it's not. It's really not, because there's such a diverse number of people with a diverse number of health concerns, or lack of them, that it just shows you that maybe it isn't tied directly to age.
Exactly.
So
vast differences in.
Yeah. So some of the abnormal things or premature aging signs and symptoms that we kind of came up with is, constant aches and pains all over the place, the inability to focus, or what some people would call brain fog, reduced energy. I think that that's probably the biggest thing that I look at when I look at this type of stuff. Mm-hmm. Weight gain, digestive issues where they're maybe not going to the bathroom as frequently or as normally as they should, and then muscle atrophy. So they look at it and they've lost muscle mass, they've lost endurance, they've lost basically their metabolic capacity, where they can no longer buffer all these things. So all these systems kind of start to crash, or give you little blinking warning lights that's saying, hey man, maybe you should pay attention to me, put some emphasis on this, because this could be a bigger issue in the future.
That's true. So it does take some maintenance to maintain our health naturally as we age, and again, as we age more and more and more, it takes more maintenance. Any of these things, whether that's constant joint aches and pains, inability to focus, you can be 20 years old, and that doesn't mean you're bulletproof. That does not mean you're bulletproof if you have these symptoms. These symptoms, it's not a red flag. And at 20 years old, 30 years old, you're not going to get labeled with premature dementia. Yeah, you're not going to get that label. However, that's the warning lights going off on the dash of your brain, and that means that things are shutting down. And just give it 10, 20, 30 years, and you'll be a statistic. So hopefully people see these things and don't just accept them or rule them out if they're younger, and say, well, I don't need to worry. I'm not in that world. I don't need to worry about, cognitive decline as a result of, because of my age. Not at all. It only gets worse, and it's a slippery slope, and then people fall off that slope. So, what are some normal age-related changes, Dr. Kolby?
So as far as like normal stuff, this is stuff that you will actually typically see when you start to get a little bit older. One of them would be like vision changes. So as you age, the lens in your eye actually starts to harden a little bit, so it's not as elastic, and you can't change the shape to change your vision as well. So you actually can get what's called presbyopia, and that's like kind of the same as farsightedness, but it's just loss of elasticity of the eye, so you can no longer see close up as well. Some of it could be balance changes, and that would be, deconditioning of your nervous system a little bit, because you've lost proprioception in your feet. This can be exaggerated if you have other comorbidities like diabetes, circulatory issues, all that stuff. I would say like loss of your ability to tolerate things. So things like showing up of liver spots on your skins because you've lost your ability to buffer things out with your liver. There's actually some research that shows that you will sleep a little bit more shallow. So your sleep depth changes just a little bit. And then obviously for women, menopause is a normal part of aging.
Yeah. So I guess the story is we accept some changes that are normal age related changes. But if we have if we have balance disorders at 40 years old, well, we can't accept that, because what is it going to look like at 50 or 60?
Mm-hmm.
If there is changes in significant sleep problems at at 30 years old, what is it going to look like at 50? So I think catching these things early, to not let them just get out of control, I think is a significant part to the whole story. And then the farsightedness. I already noticed this myself. I'm 42, and I already noticed this a little bit. And I know there's some eye exercise. Maybe I'll be talking to you about this, Dr. Kolby, later. I know there's some eye exercises, but I don't know how effective they are. I've just read a little bit about them. And allergies.
I had to
You're
sneeze
sneezing right now.
Couple of them. Yeah, there's definitely stuff you can do for your vision. Well, we talked a little bit about some supplements and stuff like that as well, in one of our previous podcasts. So if you have eye stuff, listen to that one.
That's right. We did a talk on it.
So basically, to summarize this podcast, this is going to be a little bit of a shorter one. Don't always contribute all your signs and symptoms to age. Have them thoroughly investigated, have some blood work done, have it worked up by someone who's qualified, and figure out how you can keep yourself optimized, figure out how you can get the vehicle, your body running tip-top shape, and how you can stay in your lane for as long as you can, because it is going to dramatically impact the quality of life you have in your later years. And not only like the quality, but also the quantity. There's a lot of people that are living till later ages or till later years because of advancements in medicine, but it's not necessarily the quality that they want. I think that the one thing that we look at, even like my grandfather died in his 70s, but towards the later part of his life, he was really unable to do anything because he was on so much oxygen and he was fatigued and he had emphysema from smoking. And I think if we were to ask him, what one of his biggest regrets in life was, it would be not taking better care of his body, because he wasn't able to enjoy his grandkids. He wasn't able to be as active and participate as he would have wanted to. So take the opportunity and start today. Start now, because you're really going to thank yourself later.
That's true. That's very true. And humans are reactive. We react when there's a problem versus be proactive and prevent that problem. So think about where you want to be, and in I don't know, 5 years, 20 years, 30 years. Another thing that I see all the time is the ability to diagnose. So I think everybody has a weak genetic link. Everybody has a few weak genetic links. I know I have a few, and I catch them in my blood work. I'm able to see not the genetics, but just to see the trends, the weak links in my physiology. I catch that when I was 20, there was nothing. When I was 30, a little bit of things showing up. Now I'm, 42. Where what I'll see now is I'll see some lipids trying to creep up. And my blood sugar, I'm able to keep that. I've been on that for a while, but I'll see my cholesterol start to creep up. This never was a thing before. The rest of my blood looks really, really good. So it's something I can monitor, because I know that's my weak link. I see other people that have some liver issues. That's their weak link. I see other people that, and I know you do this as Dr. Kolby as well. You see people, if they catch their early problems, the way their body wants to run, they can make those changes in because that's going to be the first one that's going to tip and create the snowball effect. So I think you can monitor these things. And then if we want to run in the right lane, I know there's lots of things. There's things that we can do for vision. We have a podcast on vision. We talk about supplements and all of that, and protecting our eyes. There's other things like, I know we talked about balance. If someone wanted to preserve and maintain their balance, what kind of strategies would you recommend?
Well, you can do like proprioceptive training. You can do vestibular training. I think that a lot of people don't really look at the importance of balance until it's gone. One of the number one causes of injury in older populations is actually falling. So I think that maybe making sure that you have balance would be worthwhile, like your balance was in good shape. So if you feel like you're, and then also having like an exam to kind of figure out why that is. Is it because you don't know where your feet are because you have some sort of neuropathy? Is it just, alterations in perception? Like all those things are things that I would investigate, because you do want to move through your life efficiently and without risk of falling.
Well, we
because
always
that's
see,
a pretty big thing.
If you break a femur after 65,
Mm-hmm.
what is the prognosis? It's not very good.
Not very good. No.
75.
Trend lines kind of like go down.
Yeah. So we really want to think of this, and it's so easy to fall even when you're young. Never mind 65, and that could be the difference between living in your home versus living in a care center.
Yep, absolutely.
For the rest of your years. So there's balance, toxicity. I know we always talk about toxicity, and ultimately reducing your exposure over a period of time. If we can do that, we don't build this toxic load. Our skin changes, everything changes. So making conscious decisions on what we're putting into our bodies and what we're putting on our bodies is a big thing. I know we did a podcast on sleep hygiene, right? We got into all of that.
That's a good one. I think that if there's one thing that everyone could benefit from, would be like better sleep hygiene, me included.
Same here. That's one of my hardest things. Promoting strength training, resistance training, promoting bone density. As we age, our muscles, as you said, Dr. Kolby, start to atrophy. They start to shrink. So we have to maintain that conditioning to preserve our cells over time. So there's a lot of things that we can do, and of course our foods and maintaining consistency in our life and all these things, doing it in a way that it can be consistent, because one day of brushing your teeth is probably not going to keep the dentist away. Right.
No.
And that's interesting how most of us, or hopefully most of us, are able to maintain brushing our teeth, but other things are not, I don't know, are not as obvious or not as
well. They're not habitual, right? So you haven't, and that's ingrained in you pretty early. Like, oh, it's really important to brush your teeth. Whereas, most of us haven't been, educated until later in life about how to eat really, really healthy. So it's not second nature, like brushing. Oh, I'm going to bed. I got to brush my teeth out.
That's true. It's paired. It's coupled. Yeah. So I think there's a lot of things to do as long as we recognize and appreciate respect what is normal aging, and not accept something that is truly premature aging. And as our population in this country and in the West gets sicker and sicker and sicker, we start normalizing the sickness, and we start normalizing what would be considered premature aging. So we have to kind of look at it, take a second look at what is normal aging and what isn't. And hopefully we've been able to do that with this podcast at least a little bit.
Absolutely. So if you guys got value out of this and you enjoyed it and you'd like to hear more like this, make sure you hit like and subscribe, turn on notifications, because we're going to continue to roll out new content each and every week on Monday, 5 p.m. Central Standard Time. You can find that information on our Facebook, anywhere that podcasts are played, or on YouTube. So we'll continue to think of new topics. I'm sure we'll come up with something that's just totally enthralling for next time. So
there's a few.
Yeah, we'll come up with something good. So, all right, my man. Well, I'm going to hit it.
All right. We'll talk soon.
All right. Bye.
Bye-bye.